Well, I have 7 slides for you. I will talk quickly about a specific case at OCAL that has the opportunity potentially for some prevention intervention. This is a clinical case of a high school teacher with vocal polyps that came to our clinic, 39 years of age, 14 years in the secondary school system, with additional curriculum teaching outside of her regular school hours. So she was teaching from 7 in the morning till 6 at night. Her symptoms began around 2013 with the hoarse throat and inability to talk, losing a day here and there, so no significant time loss. And her symptoms would improve on the weekend and be worse when she was at work. She did go to an ear, nose, and throat specialist who diagnosed her with a left vocal cord polyp, which in short involves some edema, some swelling, fibrosis along the vocal cord. The specialist made the statement that it was work-related from excessive talking and that he had seen several other teachers with this condition. The WSIB denied the claim at the operations level, which is the first level, and the teacher, meanwhile, was being accommodated with an FM system, a clip-on microphone system with speakers in the classroom. So OCAL's contribution, we took a very detailed nursing medical history to rule out the other non-work-related possible contributing factors, for which there were many. For instance, thyroid disease, lung conditions, history of allergies, whether she smoked a lot. There's a long list. We were able to rule out those contributing factors. A WSIAT search only showed 4 cases that were similar and not even identical. There's a broad category for vocal cord disorders, which includes a variety of different diagnoses. Vocal polyps is just one of those diagnoses. So for instance, one of the cases was on dysphonia, which is difficulty in your speaking voice. So they weren't even all related to the vocal polyps. So we didn't know whether this is something that is simply not being reported within our system, which is what we probably would expect. But it was a trigger for us that there doesn't seem to be many cases. So that triggered a review of the medical scientific literature in this specific case. And just a couple of highlights. There were no meta-analyses. A systematic review did conclude that teachers have a significantly increased risk of voice disorders. And again, that's a broad term for a variety of different diagnoses. The literature shows that there's a higher incidence in women, 3 times more lesions in women versus men. And it's thought to be due to the smaller larynx, the greater vocal effort that females have to produce. I'll leave it at that. When you look internationally, the occupational voice disorders in Poland account for 25% of all of their occupational diseases. So this is a big red flag. Of those, vocal polyps is the #1 cause. Also in the literature, noise, there are multiple work-related potential factors, but noise levels are a predominant one. And one study looked at actually measuring the noise level. This was a South American study, and the noise levels went up to 110 decibels during recess. And with teachers talking, their normal intensity, it went up to 90.5 decibels. The decision outcome, we've just recently found out the decision in the last couple of weeks. The advocate submitted our report, the literature review, etc., for reconsideration at the operations level. The WSIB medical consultant reviewed all of that and confirmed a direct relationship between the amount of teaching, her gender, and the heavy use of speaking excessively, especially at high volume. So the claim was allowed at the operations level, which is not publicly available. Other exposures that are linked to vocal cord disorders include, of course, the noise, the workload and the size of the class, because you have to project further with a larger size, the voice use, things like temperature, humidity, and lighting, chalkboard dust, and chemicals. One study looked at chemicals in voice disorders. At this point, we have only just received this decision, so this is good news. talking informally across all of the OCal clinics. There's only one other case that has been seen at OCal, and it was the dysphonia. It wasn't the vocal cord polyps. So this is something new for us. And in the literature, there are examples, recommendations in terms of program development for this particular issue, such as looking at workload and opportunities for vocal rest, for formal voice training with teachers, awareness training on the signs and symptoms with early referral to OC Health, voice therapists, or ENT specialists, voice disorder screening, health and safety guidelines addressing the demands put on teachers' voices, and as well noise and voice conservation programs, so looking at acoustics and reducing the noise and voice systems. So at this point across OCal, we know informally that it is on the radar screen within schools, but it's one of many occupational diseases that they have, such as communicable diseases and the like. We also know that noise is an issue in our Ontario schools. So this very well could be a case of underreporting, because we know that teachers have historically had a very good sick plan, and if they're only losing a day here or there, it may be easier to go through the sick plan. This is potentially a significant issue because teachers need their voice for their livelihood. And at this point, we haven't surveyed the schools to find out what they have in terms of program development in this area, but I'm simply highlighting it for you because it's a case that has been recognized, and there may be a potential opportunity to move this into some sort of prevention in terms of developing a program for the school system.